friends, so today I will continue the pelvic. Last class we have seen about the what is the functions of pelvis, then what all are the bones of pelvis. Please recall what all are the bones of pelvis were there. Four bones were there. There are two innominate bone, then one sacrum and one coccyx. Then functions like to carry out the body weight, trunks of the weight to the legs, then to helps in movement, then that will permits us to sit and knee, then it protects the pelvic organ, it helps in childbearing, and because of it increase width and length, we are usually less speedy, women are less speedy. That all we have seen. Then innominate bone we have seen the ischium, ilium, and pubic bone, and sacrum, the coccyx. These all we have seen in the previous class. So next let's see, I have said next we will see pelvic joint. So let's see, there are the what are the pelvic joints. So in diagram also you can see, as well as I am teaching here, we can see the here also in diagram. So there are the four pelvic joints. How many pelvic joint? Four pelvic joint. And then first is sacroiliac joint. Okay, so what is the, where is the sacroiliac joint in diagram? This is the sacrum. Okay friends, this is sacrum and this is ilium. So when together meeting, sacroiliac joint. Okay, sacro and iliac joint. So this is first point is sacroiliac joint. Next is symphysis pubis. So this you can see where the two pubic bone is joined together by symphysis. This is ligament known as the symphysis pubis. And the third bone is sacrococcygeal joint. Okay, sacrococcygeal joint. So here you have seen the sacrum. This is again sacrum and this is coccyx. I have seen the I have said the last class, like what is the a small vestigial bone, that is known as the that is known as the coccyx. So this is sacrum and coccyx. Sacrum and coccyx, where that they are joining together, that is known as the sacrococcygeal joint. And these are the 3 points. So first let's see about the sacroiliac joint. So it is two highly movable joints. Okay, sacroiliac joint, it is the two highly movable joint. Okay, then next is the where the ilium joins with the first two sacral vertebrae on either side. So where the ilium is joined on the first two vertebrae either side of the this one sacrum. Okay, so that is the sacroiliac joint. Okay, then next, so how many I have said the four pelvic joint. No? So sacroiliac joint, how many sacroiliac joint is there? Is 2, 1, 2. So this is the 2 is considered. Now third bone, that is the symphysis pubis. So what is the it is a cartilaginous joint between the two pubic bone. What is cartilaginous? Cartilage means the soft bone, which is the very soft bone. Whenever you are eating chicken and all, then you can see that leg piece is there. No? There is a soft something is there, that is known as cartilage. So this is only, it is a cartilaginous joint between two pubic bone. These all are the two pubic bone. Between that this is known as the symphysis pubis. Next one is the sacrococcygeal joint. Okay, so sacrococcygeal joint, it is a hinge joint. Okay, sacrococcygeal joint is a hinge joint between the sacrum and coccyx. So between the sacrum, it is a hinge joint between the sacrum and coccyx. So you can see in diagram also and here also. So this is about the pelvic joint. So next is the pelvic ligament. So sacroiliac ligament, pubic ligament, sacrotuberous ligament, and sacrospinous ligament. Let's see in the diagram this, then you will understand easily what all are the sacroiliac ligament and all. So these all are the ligaments. So what where we say the ligament, which one is C ligament? So this is ligament, the tendon like they will be when that hard elastic like some in our bone, it will be connected with that ligaments, that is known as ligament. Okay, sometimes we'll see football and all match playing time, that ligament here. So this is like only ligament. Okay, so I have said about sacroiliac ligament. So this is the like sacrum. Okay, sacrum and iliac both, this is known as the sacroiliac ligament. Okay, then next I said pubic ligament. So this is the pubic ligament. Okay, you can say that pubic say like pubic ligament. Then sacrotuberous ligament, then tuberous, like here tuberous is there, so sacro and tuberous ligament. Then after that sacrospinous ligament. So spine is there, that projected out part, sacrospinous ligament. So like that this all about the ligament. Okay, you can see here sacrospinous ligament. Okay, and pubic tubercles. This is So next, then we can talk about the landmarks of pelvis. So what all are the landmarks? There are especially 9 landmarks of the pelvis. So let's see this all one by one. So sacral promontory. First landmark is sacral promontory. This is known as the sacral promontory. Next is the ala or wings of sacrum. Okay, so this is the ala or wing like. This is wing like structure. Now this is sacral ala. Okay, ala or wing like structure. Next is the sacroiliac joint. Okay, another landmark is sacroiliac joint. This is sacroiliac joint. Now this is the, see, you can see here, sacrum and ilium joint. That is sacroiliac joint. That is next landmark. Next is iliopectoral line. So this is the ilium. This is the iliopectoral line. Okay, which one is coming from here? Okay, iliopectoral line. The next one is the iliopubic eminence. So here it is the eminence, iliopubic eminence. This is called as iliopectoral line. After continuation, it is the iliopectoral eminence. Okay, then after that, next one is let's see, pectoral line. So this one is the pectoral line. You can see this is the pectoral line. Then pubic tubercles. This is the pubic tubercle. This one is this projected part is known as pubic tubercle. Then after this only this is pubic crust. Okay, this is the pubic crust. Then symphysis pubis. Which one is symphysis pubis? This one is symphysis pubis. Then which you join together two pubic point, that is known as symphysis pubis. So this is the diagram, landmarks of pelvis. Okay. So if in exam they will ask sometime the landmarks of this one pelvis. So you can write this or list down 9 landmarks, and then it's easy. Sacral promontory, you can remember like how many S are sacral promontory, then sacrum, 3 S are there first, then 2 I is there, then 3 P. Okay, last one is, so like that you can remember. So next I will take about the diameters of pelvis. Actually in exam it is most important. Usually they will ask the diameter. Sometime in 5 mark questions they will ask the diameter of pelvis. So it's a little difficult actually, but I have brought for you the some easy trick to remember. So first let's remember what is the pelvic, how many diameters is divided into 3 parts: the pelvic brim, pelvic cavity, and pelvic outlet. So it is divided into 3. So let's see one by one. So here is the this is the chart total diameter. If you draw this one, this is enough for the pelvic diameter. So you can see it easily. You can take a screenshot also if you want. So this one you can see the diameters of pelvis. So I will take one by one. I will show you how to remember these diameters of pelvis. Okay, so first this one 3 diameters, then anterior posterior diameter, oblique diameter, and the transverse diameter. This is the 3 diameters we are seeing. And then here we are seeing the pelvic brim, pelvic cavity, and pelvic outlet. So this one is pelvic brim, pelvic cavity, and pelvic outlet. Here 3 parts this is, and this one is the 3 part here, the diameters in centimeter. Okay, so first what you have to remember, first you have to draw this one here in straight also 1 2 3 4 lines you have to draw, 4 cubics, then 4 squares. Then here also you have to like 1 2 3 4. Here also on horizontal and vertical both you have to draw 4 lines. After drawing here, this one you can draw if this is the optional. If you want you can remember like this also to get good marks, but here you can remember. So in anterior posterior, first there is a 1 2 3, again 3 division is there: anatomical, obstetrical, and diagonal. So this one we will see later. First we will see how to remember. So you have to see this one all. So first you have to in oblique all you have to write 12 centimeter. Okay, then in this one also horizontal also 12 centimeter. Here over 12 and 12. Then here you have to write 11 centimeter. Here also 11 centimeter. Same here 13 centimeter. Here 13. Only here 13. Here 12. So after before 11 what comes? 10 centimeter. To see here oblique diameter, anatomical, obstetric, dynamical. Then one is diagonal. Diagonal is the after 11 what comes? 12 centimeter. So 1 minus 1 plus you have to do of 11 centimeter. So this is only extra. Otherwise this is same. If you write this one in exam, enough for the diameter. An explanation also I will show you. Let's see about the how these three diameters, like how to write in sentence. So anterior, posterior, oblique and transverse. First we'll see anterior posterior diameter. So in anterior posterior diameter there were almost sub point, like conjugated or true conjugated, it was there, anatomical or true conjugated or anatomical. So we have seen anatomical, obstetric conjugate and diagonal conjugate. Okay, so it is what from where it starts. So it is the distance between the midpoint of the sacral promontory to the inner margin of the upper border of the symphysis pubis. So anterior posterior means straight. Okay, this is the anterior posterior diameter. You can see here, anterior posterior. Okay, so what they have said about in sentence, between the midpoint of the sacral promontory, this is sacral promontory, midpoint of the sacral promontory to the inner margin of the inner margin of the upper border of the symphysis pubis. Okay, this is the first diameter that is here written, that is how many, 11 centimeter. You have given this one 11 centimeter. Next one is the obstetrical conjugated diameter. So where are the what is that distance between the midpoints of sacral promontory to the middle inner surface of the symphysis fiber. So this is again same, sacral promontory to the inner of the symphysis pubis. Next one is diagonal. So distance between the lower border of the symphysis pubis to the midpoint of the sacral So this one is the oblique diameter, distance between one sacroiliac joint to the opposite of iliopectoral eminence. So sacroiliac joint distance means say one sacroiliac joint to other part of the sacral, that is eminence. Okay, the opposite to the iliopubic eminence. Then next one is the transverse diameter. Okay, so it is the distance between the two farthest point of the pelvic brim or the iliopectoral line. So it is the transverse diameter. You can see two between the it is distance between the iliopectoral lines. This is iliopectoral lines, between this one straight, this is transverse diameter, that is how much, 13 centimeter. Okay, so this all about the diameters, pelvic diameters. You can also, if you are interested, you can also drawing this one, the diameters of pelvis. So you will get the good marks. So you can draw like this, and you can point whatever that I have shown in this one box, that you can convert into this diagram also.